Hi guys, welcome to my channel. Before we get started, make sure to hit that like button, also subscribe to my channel. Top health problems. So make sure to watch the full video. Although the United States offers some of the highest quality health care in the world, there are still many difficult challenges left to solve. From heart disease and chronic illness to alcoholism and prescription drug abuse, there's no shortage of public health problems that need to be addressed. And while public health professionals are constantly engaged at the local and national levels, making a positive impact isn't easy. Tackling key health issues in America requires input from a diverse range of stakeholders, including government agencies, nonprofit organizations, and private medical facilities. The ability to collaborate across industry lines is essential, as breakthrough medical treatments and public health initiatives depend on experts with different specializations. For example, educating citizens about the risks of excessive alcohol consumption relies on the knowledge of medical practitioners, the communication skills of health educators, and the policy experience of lawmakers. But what exactly is a public health problem, and how do experts keep track of them over time? Top health problems for the modern age. Despite the rapid advancement of medical treatments and technologies, there are still many public health problems plaguing industrialized nations around the world. According to a 2018 report from the CDC, the life expectancy for the U.S. population declined to 78.6 years in 2017. The leading causes of death, which accounted for 74% of all mortalities, included heart disease, cancer, unintentional injuries, chronic lower respiratory diseases, stroke, Alzheimer's disease, diabetes, influenza and pneumonia, kidney disease. While these specific causes represent key public health concerns, there are a variety of medical issues and behaviors that contribute to their growing mortality rates. For example, individuals who are not physically active are often at higher risk of heart disease, stroke, and diabetes. As such, raw statistics rarely paint a complete picture of health issues in America, which is why the CDC focuses on prevention-based initiatives and education programs. With that in mind, here are 5 of the top public health problems the CDC is currently tracking, both at home and abroad. Heart disease and stroke. Heart disease is currently the leading cause of death both in the US and worldwide. On average, someone dies from cardiovascular disease every 38 seconds, which is around 2,303 deaths per day. The term heart disease is actually used to describe several different conditions, many of which relate to the buildup of plaque in a person's arteries or irregular heart rhythms. Unlike infectious diseases, this public health problem is highly preventable and the risk factors are well understood by medical professionals. Some of the health behaviors that contribute to heart disease include tobacco use, physical inactivity, poor nutrition, obesity. Stroke is another possible outcome of poor heart health, leading to an average of 389.4 deaths each day. Of course, congenital conditions can increase a person's chances of experiencing a heart attack or stroke, but staying active and eating healthy are essential for managing most cardiovascular diseases. Health organizations have been working to reduce the rate of heart disease for decades, mostly through public awareness initiatives and improved screening programs. Despite their efforts, the healthcare costs associated with cardiovascular disease are projected to exceed $1 trillion by 2035. To help control these expenses, the CDC has recommended promoting team-based care and clinical decision support systems focused on prevention and healthy living. Alcohol-related harm. Excessive alcohol use continues to be a serious public health issue in developed countries around the world. An estimated 88,000 people in the U.S. die from alcohol-related causes annually, such as alcoholic liver disease, hypertension and heart attacks, and strokes. While these conditions typically arise from prolonged periods of binge drinking and alcohol dependency, more moderate drinkers can still experience certain harmful long-term effects of alcohol consumption. These include high blood pressure, digestive problems, depression and anxiety, and even cancer. Driving under the influence is another key problem, as more than 10,000 people died in alcohol-impaired driving crashes accounting for 28% of all traffic-related mortalities in the U.S. Alongside the agency's outreach and public education efforts, the CDC and its partner organizations have proposed various evidence-based policies that are still under review. One recommendation is to increase state excise taxes on beer, distilled spirits and wine. The hope is that the higher price tag will dissuade individuals from binge drinking, thus reducing alcohol-related harms. What do you think of our video? Let me know in the comments section below. If you enjoyed this video, make sure to hit that like button. Also subscribe to our channel before you go.